Hey YouTubers, this is Guardian Mike again, and don't forget to subscribe. And we have some treats. We've got some follow-up interviews about the CARE conference. This is where you want to nest the concepts we talked about before, and we concluded with the code status, evaluating that. Ms. Tope, tell us about a CARE conference. What is it? Who can attend? And can people like Mr. Bippis show up who are non-lawyers?
Absolutely. In fact, I think care facilities really enjoy anyone who will attend a care conference and give input and, if need be, advocacy for the court-appointed ward so that the facility knows what the wishes are. When my case managers go out, every single time they visit with the ward, they're documenting end-of-life decisions. And so it's a responsibility of the guardian to make sure that they know what the end-of-life wishes are and that they're moving to put those protocols in place. And people like Mr. Bippis can show up and advocate for the ward at any time.
As a friend of the family, say, I want my friend, I want somebody to come along. Describe CARE conference. It's in the room of the facility usually, and different teams and different practice areas are there. Could you describe a CARE conference?
Normally you'll have a care conference once every 3 months. You can actually request that you have them once a month if you'd like. And as people are deteriorating and bouncing in and out of hospitals, perhaps that's more of a necessity. Usually present are the doctors, the dietitians, social work, recreational folk, physical therapy, speech therapy, all of the different disciplines that person is involved in for care. And you ask questions, and a lot of times these folks aren't even meeting in a timely manner, and so you've got different disciplines talking to each other. If there's a mental status change, you might want psych to come in and reevaluate the medications that these folks are on. And so there's a lot of teamwork when you're involved with the staff, and that they know you're there and advocating for your ward.
2 points I'd like to make to the folks out here in the audience. Resistant behavior versus combative behavior. When you have a medical problem, it will be managed as a medical problem. If you have a psych problem, a behavioral problem, it's going to be managed as a behavioral problem. And you'll have the elders that I take care of, they will be shipped out to a psych unit. And if you're in the Genesee County area, you may be ending up in some faraway county. Is that right?
It has happened.
And how I would use Mr. Bippis is I'm going to show you. Mr. Bippis, here's a glass. You offer me that cup. Now I have dementia I cannot answer, and I don't like paper cups, and I don't like orange juice. Offer that to me. I have capacity. I'd say, no thank you, Mr. Bippis. Now if I have some dementia and loss, and you offer that cup to me again, and I move that away, that is resistant behavior. They may want to call it combative behavior because he has bed sores, or I have bed sores. They may be trying to mask a medical problem. Give it a cup again to me. Oh, I got it. I didn't mean to do that. That might be combative behavior, but you can't tell, okay? I want you to have people like Mr. Bippis there to understand and advocate. Maybe this is resistant behavior. Mom, Dad does not like orange juice. They are entitled to say, I don't like orange juice, I want tomato juice. Is that right? So now you're at the stages there, and there needs to be some advocacy, and oftentimes take friends, take family, because you're not going to be in a condition to oftentimes be at your strongest, and you're going to go either to extreme. You're going to get argumentative, and they're going to like that, or you're going to be very mousy. Mr. Bippis, do you forgive me? He's a very congenial man. One follow-up, and then I'm going to lose my broadcaster here. I'd like to do one more tape follow-up about cremations, and then I want to talk about IRS transcripts, something I never heard of from other lawyers, but I heard it from this organization and this woman who's full of information. Fade to black, we'll come right back.